So today we're going to talk about, it's actually two systems. It's called the one weight and the one dose system. So the two of them together. The one weight is actually the scale. So we were able to get some funding from in 2024 from Epic. And as we looked at kind of what are some of the needs and other things we could use here in the service, one of the things we've been working in the last couple of years, Dr. Michael Kim from UW Hospital Pediatrics has been really focused on accurate patient weights. Really, he looks in that little pediatric population, but regardless, all of our patients, we can use accurate weights on. Many of the medications that we give should be weight-based. So right now, we can ask a patient's weight or do a best guess. Everybody's 50, 75, or 100 kilograms. But now this will actually give us accurate weights and provide actually that better medication dosing. So, we kind of border on, or not necessarily overdosing, but potentially underdosing patients. Are we giving you enough pain medications? And this integrates with our Cot. It's only been out there about a year and a half. It's a company out of Minneapolis. And we're able to get them to come and install all of our Cots with in-Cot scale. It's actually really simple. They came and each one of them took about 5 minutes to put on. Once we got going, it actually mounts directly to the Cot. It can be pulled off of the Cot if it gets contaminated. So, occasionally it's just a significant mess on that Cot. The whole thing can come apart, all get wiped down, all contaminated or cleaned. It is all sealed. That mattress goes right back on. The only working part of it right here, there's a battery embedded in that top scale, but then right here is kind of the headset for it. Turn it on, hit it, a couple of different steps, arms down, seatbelts off. We hit that tear button, it zeroes out the Cot. You have to wait 1, 2, 3, 4, 5. Patient gets on that Cot, 1, 2, 3, 4, 5, and we get a scale, or we get a patient weight. So the big thing for us as far as emergency situation is going to be accurate patient weights. It goes all the way down to 15 pounds. So we can get pretty low with our patients on there, down to those little kids, with actually getting some real patient weights. As I mentioned, the other part of it is called the one dose. So the scale will actually integrate with our phones. So all of our ambulances have phones in them. There's an app on there. We pull it up. Will actually give us that patient weight. We pull up our patient protocol. One of them might be sedation medications, right? Calming a patient down before maybe we have to take an airway from them and assist their breathing. That is technically a weight-based medication. So when we give that medication, whether guessing a patient is a small, medium, or large patient, right, 50 kilograms or 100 kilograms, this will actually give us that patient's real weight. And part of that app is our protocols are built into that app and will actually give us that medication dose in both a volume and a concentration. So we like to call those things 2 a.m. proof, right? So it's still always, you gotta know your protocol. You're always gonna bone set off your partner, but here's now a second or third way where we can actually ensure that we're giving the correct dose of medications for a patient. So, it was actually pretty great. The installation took 15 minutes and just that initial training of just using it as a scale, these 3 steps, zero it out, put your patient on there and you gotta wait. Within 5 minutes after installing the Cots, we were weighing patients. They went on a first call shortly thereafter and said, I used it, it's great, right? We're actually able to get accurate patient weights. Lying flat, this will actually weigh a patient within 3% up to 700 pounds. So we can get some good accurate weights on our patients. One of the things we had talked about previously is kids. Previously, to get accurate weights on kids, right? Yona was asking a parent, hoping, when was the last time your kid was at the hospital? What was their weight then if they're not consistently weighing their child? The secondary tool we have, it's called a Braslow tape, or a length-based color-coded weight system, which we determined the length of a child, and then from there it was kind of a best guess on their weight according to, I believe it's the National Institute of Health, height, weight, corresponding, and then we can get medications based off of that. But we all know, any kid that's this tall, they don't all weigh the same. So it was even back to then, right? It's a best guess on what the average kid weighs based on the average length of a kid. This will give us that accurate information on an accurate weight, all the way down to 15 pounds. And the solution, if they're under 15 pounds, is actually put somebody else on there, weigh him, and then add our kid, we get an accurate weight. we're a tax-based service. So to put this on our cots, and we have a fleet of 5 ambulances, so we want to make sure that regardless of the ambulance we're in, that patient's getting the same tools, right, regardless of who responds. So with the opportunity, right, for Epic to provide those funds for us to our citizens, that means the taxpayers don't have to pay for this, yet they're ultimately going to be the ones that benefit, not just our residents, our visitors, the employees of the city. Anywhere we go to, they're going to benefit from the technology. As I mentioned, it's only about a year and a half old. The company is pretty new. We like to call it healthcare in motion. We're bringing that medical world to your home. We're not just a taxi service or an ambulance driver. We actually have trained providers coming out there. So to get a medical grade system that integrates and functions well is a great opportunity for us to add that and bring that here for our district.